Hello, ladies and gentlemen. Thank you very much for joining today on this live webinar on how to naturally treat an enlarged and inflamed prostate. Now, this is a very important subject for men, of course, and I do sell my products online, and I sell you know, dozens of bags of prostate tea every month, including on eBay. But I only do about 1 or 2 appointments a month for new cases of prostate. So I believe there's a lot of men out there who have the early signs and symptoms of prostate and who are not treating it. So I hope this message gets to them and you understand the importance of not just buying one bag of tea from me or anybody else, but a more holistic treatment. So we're going to talk about, of course, the signs and symptoms besides just high PSA numbers, which really, high PSA numbers, if they're high, really could indicate prostate cancer, which is a very difficult cancer to treat. And you're going to learn that even inflamed, definitely enlarged prostate is also slow and difficult to treat due to the proximity of the prostate gland and the inability for the herbs to really reach it easily. So we're going to talk about the symptoms of enlarged prostate in particular. And we're going to talk about the difference between to determine how much of it is enlarged and how much of it is due to inflammation. So you can have an inflamed prostate and not too enlarged. You can have an enlarged prostate, not too inflamed, but most cases are a combination of the two, enlarged and inflamed. So I'm going to talk about that and the symptoms. Then I'm going to talk about the dietary guidelines, which are really important, which is where most men go wrong when they just order a bag of tea from me and they don't change their diet. And then, of course, we'll talk about the herbal remedies. There are some herbs for inflammation in general that need to be taken if inflammation is clearly a major factor. And there are herbs to reduce the size of the prostate, and there are herbs that help with the flow to prevent any kind of blockage. So usually just one bag of tea is insufficient. Even though I'm selling a lot of prostate tea and I get a lot of good feedback and testimonials from people who are purchasing just my prostate tea that's helping with their flow, reducing their nighttime urination. But, since these people aren't my patients, I don't know the whole picture. I don't know if their PSA numbers are coming down, but it definitely helps with the flow. So we're going to talk about the difference between taking a tea and taking an Ayurvedic formula. So first, the symptoms, which I think most men are aware of, but let's talk about the symptoms of enlarged prostate. Then we'll talk about some symptoms of inflamed prostate. And then if you've got both, then enlarged, usually you're going to get that frequent urination, run into the toilet in the day, difficult to start the urination. So you feel the urgency, but then when it's time to urinate, it's not moving. And then you get slow. You don't have that nice shooting ability to be able to write your name on the wall anymore. Then you get a lot of dripping. So it's basically because of the enlargement, the flow has become a problem. And you can get even incomplete emptying of the bladder. And in some severe cases, you can get blood in the urine. And there's usually a lot of dribbling in the underwear and things like that. Now, complications can include urinary tract infections, even bladder infections. Blood in the urine is never a good sign with this condition. And bladder stones. And these are the main. And of course, it can progress into prostate cancer. Now, Ayurveda has a very different view than the West. We're not going to get into the details of that, but Ayurveda sees it as an imbalance of both Vata, Pitta, and Kapha dosha. So that's why these need to be balanced. Now, and that's part of the treatment. See, each person with prostate, say a man who's very Pitta, warm, hot, body temperature, he's going to have more burning sensation, more urgency, more pain. Well, a man who's more Kapha is going to have more blockages, inability to urinate because of his excess weight, excess muscle mass, excess size, and probably larger prostate. Then a Vata man will be more dry skin, and have more difficulty in urination, even though the prostate isn't as large. So there are differences. Since all three doshas are in balance for this condition, um, each individual, of course, is either dominant Vata, Pitta, or Kapha. So the treatment does adjust per individual. That's just an important point to note, which is a big problem with the Western mind, is they just think there's one treatment for everybody. But I can have three men and vary the treatment quite a lot, particularly the diet. Now, those are the clear signs for enlarged prostate because it's restricting your flow. Now, the signs of inflamed prostate are also quite simple. Pain and tenderness on the groin. Most common way is like a man is riding a bike and he then, feels that pain when he's riding a bike. Or if you don't have a bike, you sit on the arm of a chair and sit down. And if you feel that pain and tenderness in that groin area, then that's the inflammation. Now, most people, or most men in this case, if they have an inflamed prostate, will generally always have muscle pain as well and joint pain as well. So usually the whole body's inflamed. So there's inflammation systemically throughout the body, muscle pain, maybe even they already are taking pain medicine or something for their arthritis, or they're just toughing it out like a lot of men do, but there's pain and inflammation. Signs of inflammation are always like heat and swelling. So, or either of. So if you have inflammation on your knees, they'll get a little warm or they'll swell up and get puffy, and then you have to lie down and let this swelling come down. Maybe you don't feel it except when you exert yourself or run upstairs or something, then you feel the knees can inflame. Or if you're just, even working on the mouse all day long on your computer, you can feel the joints start to become inflamed and there's excess heat. You can feel the heat right on the joints. That's inflammation. So if you've got inflammation in your joints and there's even any little tenderness in the groin area, you have inflammation in the prostate. And that's just these two criteria. How much is inflammation? How much is enlargement? Are very important. And then, of course, the PSA number is also important to know. The larger that number, the more advanced the condition, and the greater probability that it progresses to prostate cancer. So again, like I mentioned in the beginning, it's difficult to reach the prostate. So you have to drink liquids with the herbs in the liquids to get them down to the prostate. A lot of people buy herbal remedies for the prostate and then they take them with food. Well, the benefit is going to be minimal because you're going to end up digesting these herbs and they're going to get into your bloodstream, which is good. I mean, the prostate has circulation, but as per Ayurveda, these prostate herbs, just like urinary herbs, bladder herbs, kidney herbs, should not be taken with food because you're trying to get the herbs down to the kidney bladder pathway and flow them through there. And so they can have their effect. And if you eat them with food, you take them in too small a dosage, you don't take them with enough water, then you will not get an effective treatment, even if you're taking the right herbs. So sometimes people have good herbs that they find or some formula they find, and they're just not taking it the right way. So the devil's in the details, they say. And now, as far as dietary guidelines, anything inflammatory is going to make it worse. And what's inflammatory? Well, number one, coffee. The coffee bean, not the caffeine, the coffee bean. All coffee needs to be removed immediately if you have inflamed prostate or any serious prostate condition, or even just excess urination at night, urgent urination, bladder infections. I mean, you should just stop the coffee. Even women will get bladder infections and urinary tract problems just from the coffee because it's inflammatory. Just like people with irritable bowel, ulcerative colitis, they have to stop the coffee. It's inflammatory. I know there's a lot of people out there promoting the benefits of it. And I didn't say everybody has to stop coffee, but in this case, it's clearly counterindicated. It's not the caffeine, it is the coffee bean. That's the bad boy. So you can do some green tea instead. Next is chocolate. Yep, I know it's been hyped as a superfood. Nope, it's not a superfood. It's another inflammatory bean. And it also happens to have caffeine in it. So it's counterindicated even for anxiety, ADHD, and insomnia, but also a lot of inflammatory conditions like prostate. No chocolate, no coffee, no nightshades, tomatoes, eggplant, bell pepper, paprika. These are all pretty much people are starting to even hear from the mainstream medical profession that these nightshades, cruciferous family, are inflammatory. Finally, science has caught up with ancient knowledge because they've known this for thousands of years that these nightshades were inflammatory. And of course, most people are in denial until science figures it out. And science has finally made a breakthrough and figured out it's the lectins in the skin. So it is the skin, it's the bad part, which is usually the problem with a lot of foods is the skin or the outer part, like the egg. Obviously the shell isn't edible, and a lot of like nuts are basically seeds, and the skin is the problem. And they do say it's the skin of the tomato. So you can buy tomato sauce that's skinless and seedless. And apparently, I'm not 100% sure that is a better choice. Now, of course, in Ayurveda, they just say skip the whole tomato, and definitely tomato sauce over a few sweet cherry tomatoes. So the nightshades go. And of course, sugar is inflammatory. And no, fruit is not sugar. I don't know. People get this stuff off of YouTube. I don't know. The information there has just really got people confused because most people who are speaking on YouTube, even though they sound quite professional and they're quite good at presenting, they're just researching themselves on Google, and then they compile it and then they present it in a very convincing way. But unless they're treating people every day, knowledge is this type of information isn't going to help you. It would be like researching how to ride a horse and then summarizing it and telling the rest of us, well, it's really of not much value unless you've rode a horse. And somebody who never read about riding a horse but can ride a horse is more qualified. So it's very, very important if you're listening to people online that they are in practice, that you can book an appointment with them. Then at least, they have the experience of meeting different patients and they don't get locked into thinking this is the only treatment because this is what they concluded from all of their research. Research is really not that valuable. I mean, if you want to be a car mechanic, how much research is going to help? You might as well just go get a job in a garage somewhere and learn for 5 years. If you're going to learn to ride a horse, research doesn't help you hardly at all. I mean, a little information, few tips, heels in, toes out, back straight, shoulders up. I mean, there's certain things you can study, but at the end of the day, you got to do it to be good at it, and definitely to be qualified to teach another person. You have to practice what you're preaching about for at least 10 years, hopefully 20 years. I mean, even if you want to take horseback riding lessons, your teacher has probably been riding for over 20 years. So same when it comes to health advice, only go with people who are doing appointments and they're over 40, 50 years old, so they have some experience. I digress, but let me go back onto the dietary guidelines. No spicy food is another problem. The prostate's a very sensitive organ, and chili peppers, hot peppers, cayenne peppers are probably the worst thing for it. We generally try to reduce down a lot of the, not all, but the animal protein, particularly the red meat, because this is a Pitta condition. So we take out the red meat, we take out fried foods. We also take out most dairy, but not all. I mean, low-fat milk's all right. Ghee is, of course, good. But yogurt, cream cheese, most cheeses are left out. And most fruits are actually okay, particularly sweet fruits. You don't want too sour of fruits. And this is the sophistication of Ayurveda. It's very sophisticated science. And sweet cooling fruits is what you want, like papaya, cane sugar, berries, strawberries, raspberries, and of course, avocado, the oily fruit, and less citrus. And you should always try to eat better and no packaged food, no frozen food, no fast food, but the real, um, and then less protein, particularly if the prostate's enlarged. We mostly get meat eaters, heavy meat consumers, which are usually consuming a lot of animal protein. That's pretty hard to get excess protein if all you're eating is beans every day, which, 70% of the world is getting their protein from beans. So if you think you can't live without your hamburger, you're incorrect. So all cancer cases, particularly tumor type of cancer cases, not blood cancer or liver cancer, but where there's a growth, whether it's prostate, whether it's breast or any type of growth cancer, we cut the protein right down. And to pretty much, it would cut down all the animal protein because that's the easiest way to cut down all the protein. Just put somebody on beans and then they'll lose weight. They'll shrink because you remember, you're trying to shrink the prostate. So if a person's overweight by 50 pounds, I say, not only am I going to shrink your prostate, I'm going to shrink you because if you lose 50 pounds, that prostate's getting smaller and you're not going to be shrinking anything unless you cut this protein down. That's why we get a lot of weightlifters with the prostate problems because they love protein, because they're trying to build muscle. And even though the prostate's a gland, it's got some muscular type of capacity to it. And all protein is making everything grow. We know all cells in the body are growing from protein. It's a foundation to every tissue in our body. So if you're having a lot of protein, you're going to start growing either bumps, lumps in the body, tumors, cysts, fibroids, and enlarged prostate. So you're cutting down the protein. And the easiest way to do that is just start doing more legumes and cut back on the animal protein, particularly the red meats, the pork, and these. And now, if a man thin and he can't lose weight because he says he's already thin, then there's a little more flexibility. That's where we'll do more fish and salmon and lentils, and really less, not go too extreme on the beans because that could deplete the person too much. And also dried fruit are counterindicated. Even pumpkin seeds, which of course in the West, they like to do pumpkin seeds for prostate, but the seeds, sunflower seeds, even particularly peanuts, are all counterindicated. This is, of course, according to Ayurveda, and Ayurveda is working because I've reversed in my long career dozens of prostate cases, including prostate cancer. And I'm just following Ayurveda, not YouTube. But soaked almonds are okay, and even have to lower down again the consumption of certain meats like grilled meat, fatty, fatty meats. Definitely sausage. Sausage is one of the worst meats. Sausage and red meat will go whether you're thin or overweight. And some men, particularly if there's a cholesterol issue, the egg yolk will have to go. So it depends on individual. It depends on how much inflammation there is, or it depends on how much weight there is to be lost, and whether the man has room to lose that weight or not. So the diet is individualized based on the individual man, and that is the beauty and sophistication of Ayurveda. It's always individualized. And even during a treatment, the treatment can change as the person progresses. So if you got somebody who's 20 pounds overweight, now they've lost their 20 pounds, and of course the diet could change again. Let me share my screen now and show you a few herbs that are used to treat prostate. Here's my tea. prostate tea. Now, this is the one that everybody's ordering online because you can get it on my website, herbmanteas.com, which is what I'm referring to. And we do sell it on eBay. And we don't sell it in capsule form because you need to drink it. And if you can read carefully, you can understand it says inflammation. It doesn't talk about the size of the prostate. It doesn't talk about reducing down the size. It's focusing on the inflammation and the flow and helping to, prevent any blockages. Now, if we look at these herbs here, it's a kind of an interesting formula. Being a kind of a seasoned herbalist, it really started off with the Western herbs with the supplemento berry, which is really the most important Western herb for prostate. And then you have these supporting herbs, Daminia, which is actually a laxative, Yohimbi, which is also a laxative, and horsetail, which is a diuretic, and licorice, which is kind of a soothing, catalyst herb that helps the other herbs work together. That's kind of the base formula, even kind of based on Western herbalists, even though Yohimbi is from South America, it is used in North American herbalism, not in European. Now, Gokshura, which is the first herb, that's a Indian herb, and that's a diuretic and the most, one of the most important herbs for prostate condition and men's healthy prostate gland. And it's anti-inflammatory. So that is actually the first herb. So it's kind of like stacked it on top of this Western formula. If you go online, you can find a lot of formulas with the supplemento berry and the horsetail and the licorice and some of these herbs. But then you don't see the Gokshura because that's an Indian herb. And then there's another herb, small flower willow, which very few people have heard of. And this is from Eastern Europe because there's two Western systems. There's a North American system, which has some influence of South American herbalism. And then there's European, Western European, and then the Eastern Europeans. They had their own system under the Soviet rule. And this is the premier herb for prostate conditions in Eastern Europe. So a small flowered willow. So this was added later. Oh, and there's the nettle. There we go. We didn't see the nettle. The nettle is, of course, a Western herb, but it's used in other cultures. So it's a kind of combination of a little Gokshura, the Indian herb, Western herb. You got Yohimbi from South America, and then you have small flowered willow from Eastern Europe, which is that's all they take for prostate in Eastern Europe is small flowered willow. And I was actually talking to an herbalist from Europe, and he told me about this. And I discussed it with him. Then I looked it up, and then I added it to the tea. So that tea probably didn't change for 15 years. Maybe originally 20 years ago, it didn't have the Gokshura. Then I added the Gokshura quite some time ago, maybe 20 years ago. And then just maybe in the last 5 years, we added this small flowered willow. So this tea is very effective. It's definitely keeping the flow going. Now, if you take it, you'll realize you start urinating more than less, but because that's what's got the diuretics. So you can't take this too late in the evening. It does really keep the flow going, and it's got a few herbs in there for your libido too, because some of those do help the male reproductive system in general. And I'm talking about it right here on the website. So that's the tea, but it's not for the enlargement. It's for the flow, which is very important, and the inflammation. It's anti-inflammatory, but you don't want the flow to stop due to the enlargement, because then, of course, you can get this urinary tract infection and even bladder infection and even bleeding from the blockage. So it does keep things moving and it keeps inflammation down, but it's not a complete treatment, even though people are ordering it, thinking it is. But here's what you want here. This is the prostate formula. See there, it says for enlarged prostate. And this is the more powerful formula because, of course, you're taking the herbs in powder form. And here we've done a lot of updating to the website a lot, so there's a lot more information about the individual herbs. There's Punarava, which is basically anti-inflammatory and it's used for managing prostates. It's also a strong diuretic and good for urinary health. And it's kind of the base. Gokshura is the same herb. Tribulus is the same herb that you saw in the tea. And there it says the anti-inflammatory, reduce the swelling in the prostate. Very important herb. So if you take the tea and the formula, you get a lot of Gokshura. And this is very important. And it's used mostly for benign prostate conditions. And it's also helping with hormonal balance, testosterone levels, very important herb for men. Now, Kanchnar Guglu, this is 12 herbs. This is the formula. So this is a formula within a formula. And this formula is used to, it says reduce the enlargement and swelling of the prostate gland. But the same formula is used to reduce tumors and any type of growth in the body. So this is what it's designed to do, shrink and break down growths in the body. And we use it for tumors too. We just put it with other herbs. So this is very important. That's a 12 herb blend. We import that from India. It's already pre-mixed in these 12 herbs and we put that in there. And then there's Chandra Prava. Chandra means cooling because you can't have anything heating. It's like a cooling diuretic. And actually, if you look at, it's 36 herbs. And if you look at the ingredients in Chandra Prava, there is Shilajit in there. We're going to talk about Shilajit. But the beauty of Chandra Prava, it's balancing Vata, Pitta, Kapha. And like I said earlier, this condition is an imbalance of all three doshas, which is why the diet is also important. It's also an anti-inflammatory. It's also a diuretic, good for urinary function, and supports overall health of the prostate and urinary tract. And Varuna is a strong diuretic, anti-inflammatory. And sandalwood is well known for its cooling and anti-inflammatory effects. So cooling is a very important point in these inflamed prostate conditions. You can see even the herbs are cooling, like sandalwood is cooling. And that just shows you that anything hot, even too much pepper, definitely garlic and hot spices are all counterindicated with inflamed and enlarged prostate. So usually it's best if the two are taken together. As you can see on our site, we got a lot more information now. It's telling you how to take it. You take 1 teaspoon, and it says here to take it in a large cup of the prostate tea. Between meals, timing, between meals, not with food. So that's the main combination, the tea with the prostate formula in it. Now, if you do an appointment with me, then of course I'll give exact dosages based on your condition. Now, if there's a lot of inflammation in the body and pain, then often I'll put in an anti-inflammatory like this, which is using frankincense powder. Most people think it's turmeric because it's orange, and there is curcumin in there, but the real powerhouse is the frankincense resin, which we call boswellia, and the extract of frankincense, which we call shilaki. Those are the real anti-inflammatories. And then the amlaki, there's a little turmeric, and there is curcumin in there all together. This is the 95% extract. People say, oh, our curcumin's the best. Well, it's only a few factories making it in the United States. And it's either 95% or 60%. So you can get that anywhere. So this sometimes I'll include, which, you take this, how to use, you take it morning and night. It even has different instructions for Vata, Pitta, Kapha types. There's a lot of details on our website. We're really trying to update it a lot to give the patients more information about how to take these products properly. So that's often included if there's a lot of inflammation. And then another thing that's often included is this more Shilajit. Now, if we look at Shilajit here, we only sell it in powder form. We don't sell it in capsule because we want to mix it with other herbs. And this can be combined and added to the prostate formula, which does have small amount of Shilajit. And if we look here, we talk about Shilajit. I'm sure somewhere in here it talks about it's good for men. Mostly men buy it for the strength, sexual stamina, libido, and even stronger erections. This is the main reason we sell it. But it just, and women can take it too. It's not going to like make you grow hair on your chest or anything. It's really a panacea. Most men, women, children, almost everybody can take it. And we sell it in powder form because we want you to mix it up. And I had some on my desk this morning. I just put like a quarter teaspoon in a little warm water, and I drink it like a tea in the morning, or I mix it with other herbs. And of course, where you get your Shilajit from in India is very important. And nothing against Pakistanis, but a lot of Indians, they don't like the Pakistani Shilajit. And there's certain mountains that have better Shilajit. It's just like wine. There's a lot said about where you got it from. But this can be added, particularly if there's weakness and fatigue in the person and the urinary flow is still a problem, because this is traditionally used for stamina and weakness. So these can be added to the overall treatment along with the dietary changes. So I hope that gave you an idea that this condition is treatable. I've treated dozens of cases. Like I said, I get like 1 or 2 new cases per month. And like I told the new case this morning, it's really more up to you, whether you change the diet, get rid of the sugar, stop the smoking, stop the alcohol. Of course, I try to get rid of all these bad habits. And most people have multiple health issues besides just prostate. They may particularly come to me and just, I want to treat the prostate. I don't care about my blood pressure. I don't care about my diabetes, and they don't really want to change their diet. They just want to treat the prostate. But that's not the way it works. You really have to treat a person holistically. And so they often have, if they're having too much protein, they could have other types of growths in the body. If they have inflammation in the prostate, they probably have joint inflammation. So when the prostate inflammation reduces, your inflammation in the whole body is going to reduce. When the size of the prostate goes down, you're probably going to lose weight too. So, your body responds holistically. I mean, the herbs just don't go to one little spot and only treat that. And you can't, your sleep, your anxiety, your exercise, all these have factors. So in fact, that's really the secret to Ayurveda, to a large degree, that all Ayurveda doctors are well aware of, even when we have very complex cases, as serious advanced conditions like cancer or, extreme ulcerative colitis cases or kidney failure cases on dialysis. The patient's always very focused on that one condition, but the Ayurveda doctor, if he's got experience, he can just sit back and start fixing all the other little problems, the sleep, the digestion, the constipation. And one counter of prostate, you should never be constipated. And many people don't even know what constipation is. They think, hey, I'm going once a day, I'm not constipated. No, not in Ayurveda. You're going to be going twice a day. And if you have any hard stools, this can really aggravate this prostate condition. And this is all according to Ayurveda. So the bowels have to move, the inflammation has to be down, the protein has to be managed. You can't be doing inflammatory foods. And, these are all very important. And like I've said in the beginning, it can take 6 months to a year to treat prostate case. It's very slow going. Like inflammation in the body will be down. A lot of times the inflammation in the body will drop. There's no more pain. The man's able to keep urinating with the T, but the PSA is slowly coming down and it's slowly getting smaller. But I would say this is a lot better than surgery. And the good thing about it in Ayurveda is once you've treated it, you've treated it. Once you've shrunk it down, you've shrunk it down, as long as you don't do the same things to make it larger again. And like I said, it's that high protein, high animal protein diet that creates the enlargement. And then if you have a lot of chemicals in your diet, you're eating junk food, you're not having organic food, you're having all this, you're exposed to a lot of chemicals, bad water, bad air, etc. Then of course, these chemicals can only complicate the situation and you can end up with prostate cancer. So, which is why I only have organic food and avoid all these chemicals, is because, the body can't rid themselves of a lot of these heavy metals and toxins and plastic, which are environment. So we always should be taking care to eat as well as we can. And of course, according to Ayurveda, to our body type, and then deeper, we should eat based on our health condition, as we discussed here today. So holistic treatment is the only way to go. Don't just buy my tea online, do an appointment and treat yourself holistically. Those are my advice, because I have climbed the mountain and been back down, and I can take you up there and bring you back down. There's no need for you to Google it forever online and keep guessing with such a serious condition that is difficult and slow to treat. You have to have experience just to know how long it takes, what it takes, and how much herbs it takes, and all of this information that only comes from experience. Okay, ladies and gentlemen, ladies, please send your men this video before it's too late. Men tend to procrastinate to the last minute, and men, come on, step up to the plate, do an appointment, be a man. Let's change your diet and take care of this condition before it advances. Thank you very much, ladies and gentlemen. I wish you the best of health, and happiness, and longevity.